Hello, and welcome to Skills Without Borders podcast, where we are dedicated to share skills needed to break career barriers for health, STEM, and public health professionals worldwide. Hello, I am your host, Andrea Clark, and we have a special guest with us today, Dr. Joel Collazo. I'm really excited today to talk to him about the multilingualistic language and how that may enhance medical treatment and overall patient care. So, thank you so much, Dr. Collazo, for joining us today on the Skills Without Borders podcast. How are you?
I'm fantastic. Thank you for inviting me and for having me. It is a pleasure. It is a very good opportunity to share with you and anyone that's listening to us, my thoughts about what we're going to be talking today. So thank you once again for inviting me.
Oh, no problem. We're so excited to have you on today. So, Dr. Collazo, can you share a bit about your background with our audience and how multilingual skills that you have played a role in your medical education and in your career as well as a physician and professor?
Well, yes, I was born in Havana, Cuba.
Okay.
I'm not going to tell you the year. I mean, I don't hide my age, but it's not the focus now. So I was born in Havana, Cuba, raised there, and I studied medicine, graduated in 1994, and then began my specialization in histology. Then I moved to Peru, where I lived for 9 years and worked. Actually, in Peru was when I worked the most, as a physician in reality, because I mean, doing histology in my natal country, so I practiced medicine for 9 years in Peru, and then I moved to the U.S. in 2007. So then I have a master from Barry University here in the U.S., and then I pursued a PhD at Walden University in public health with a concentration in epidemiology. And definitely, yes. I mean,
Yeah.
speaking languages other than Spanish has helped me since I started my career because, I mean, there's a lot of literature, there's a lot of information that you can find, in languages other than your native language.
I'm curious, you have such a vast background when it comes to histology and actually a practicing physician. What motivated you to go to that public health route? How did you make the connection between the two? And where did that desire come from?
Well, some people have asked me that question as well. The point of going to that PhD, there were, let's say, two main, let's say, aspects that
Okay.
led me to that route. And was when I was living and working in Peru. I worked a lot with underserved communities, and I could see how social determinants shape the way these people live, types of diseases that they normally suffer based on that, and prevention, which is barely existing in those communities. So that was something that I said, okay, in my education, I never got exposed to that situation because back in the time in my country, we did not have uh, the reality was quite different. But when I started seeing that, I said, okay, I mean, this is actually a lesson, right? I'm learning a lesson here. So when I moved to the U.S., I started studying to to pass the USMLE and things like that. It was difficult. I have my family abroad, so I had to work. And then at some point, and I love teaching.
Yeah.
I love teaching. That's something that I mean, it's one passion that I have. And then I realized that I needed something from, I mean, a diploma, a career from the US. It was difficult for me to continue in the route of validating my medical diploma here. So I had that master from Berry, and then I pursued the. I said, well, why not do something in epidemiology, in public health, because in reality, this is something that I learned. This is something that I saw. That's a reality. And then when, even though obviously the U.S. is not the same as what I saw in Peru or Latin America, there are, situations in which, you need to analyze how the society and the social determinants and all those stuff impact in the public health.
Yeah.
So that is how I said, well, let's go to that route. And then I began the PhD in public health.
That's fantastic. I think it makes you so much more well-rounded. My personal experience, my background is I have a lot of laboratory background and experience. And I came to that realization as well. It's like, okay, I've done all this bench work, in the research area and laboratory medicine where I had a long career there, but how does this really translate into the community? So it sounds like you wanted to look at that epidemiology route and kind of make a full circle with your actual medical practice, extensive histology background. So that's fantastic and very inspiring to say the least. Dr. Collazo, I'm just going to ask you, how many languages do you speak?
Well, I speak Spanish, obviously. That's
Uh-huh.
my mother tongue, let's say.
Okay.
I studied English when I was at the university. So fortunately, when I came to the US, I was not in zero with my English. I also studied while I was in the university. I studied French in Havana in the French Alliance, and I had my things with Italian, with German when I was doing the specialty, but I don't speak German. I can say a couple of words. And Italian, well, I mean, it's not that different from Spanish. So I can say a few phrases, but I mean, I can say that I speak Spanish, which is my native language. I can speak English, and I speak French, which I try to practice. I try to read things out loud so that I can hear myself. But these are the three languages that I can say I speak. Yeah.
Wow. I'm very impressed. Every once in a while, I try to get on a Duolingo app, but I never actually finish it. So I think that, communication skills, especially on a multilingual level, it really connects you with the world and essentially enhancing the learning experience. So for medical students in particularly and healthcare professionals, do you think it improves the comprehension or even the retentive learning experience when it comes to retaining that medical knowledge?
Definitely. I mean, the possibility, for example, that we had while we were studying medicine to study English as part of it was a matter subject. We had to pass it. We had to study to pass the test. So if you failed English, you failed that course and you could not continue. So it forced us to develop some other skills, right? And at the moment that a medical student or any other student is exposed to some things other than just the subject matters that they have to go through and pass, their mind, their brain, the brain is fantastic. So the brain is going to be opening a lot of different avenues, so different skills to learn. I mean, the way you learn a language in a natural environment is not the same way you learn it in a classroom, and it is not the same way you study and learn mathematics and the way you study and learn biology or medicine. And let me tell you something, that's something that now that you ask me that, I remember when I was doing my specialization in histology, we had to do math, we have to do physics, we have to do chemistry. And then we say, why do we need this? I mean, I'm going to be a histologist. Or the other one was going to be a biochemist. And the other one, because in Cuba, we have those specialties. But I remember the chair of the department, she told me, because you're being prepared to be a professor, but a researcher. And the way a researcher thinks is not always aligned with the way a physician thinks, right? So we all follow the same scientific method, but the logic is, there are certain differences. So I think about that, and I think that with language is basically the same thing.
Yeah. That's great. I never thought about it like that because we've all been in the rigors of those science classes and you're thinking like, okay, for me, botany was not, oh gosh. I was like, why do I need to be in this botany class when I'm going more on that biological and cellular molecular avenue? But you're right. It kind of opens you up mentally to think different about the science and how that science translates in other areas in the world in different practices. So that's fantastic, and that's a great way to look at it. Thanks for sharing that. Dr. Collazo, also with approximately 68 million people in the US speaking a language other than English at home, and I think it's about 26 million have a limited English proficiency. How do you foresee that skill can help bridge communication gaps? And also, ultimately, this is big in especially minority communities, building the trust between the healthcare provider and the patient at large.
All right, so let me start by asking you a question. How would you feel if you have to go to a country where they speak a language that you have no clue about? It's
I would definitely feel overwhelmed. And, I can definitely see myself withdrawing back a little bit. So it eradicates that comfortability.
so that your answer helps me, to move on with answering your question. So in reality, when you have, especially in a multilingual, multinational country like the U.S., and you have people coming from all over the world, the fact that you have a physician or a nurse, a physician assistant, anyone involved with their health, right, that cannot communicate effectively with those people are going to be doing exactly the same thing. They will be feeling overwhelmed. They will they will refrain from going to the doctor. As simple as that, because they feel like not well understood, right? And on the other side, I mean, I can imagine also, because I lived in Peru, as I told you, and we had, my experience working there was with patients that came from the Andes, for example, that lived in Lima, but they came from the Andes, and they speak Quechua, they speak Aymara, they speak different indigenous languages. Most of the ones that I dealt with, they also spoke Spanish, but many did not. So it's difficult for me, or it was difficult for me to actually get the information that I needed to obtain so that I could actually make a diagnosis and give him a treatment. But not only that, if I had an interpreter, which was usually a family member, right, it was difficult to explain certain terminology or to actually grasp the idea. I mean, I'm telling you literally the idea of what they were trying to express, because there are words that are difficult to translate. So if you know the language, you can also have a very good approach of the culture. So it's not only about that effective communication, the words, it's not just the translation. It's also the understanding, the tone. A word can mean different stuff depending on the context, depending on and English is a very good example of that. You have one word that can have many different meanings. So it's a dual situation, right? So the patient will be feeling like overwhelmed, and the attending is going to be also feeling like, how can I express my ideas? How can I make sure they understand what they have, what the treatment is, how they need to adhere to that treatment? So it's and then going back to the U.S., we have many people that don't speak English, not only Spanish speakers, but many people that don't speak English. Or that doesn't speak it fluently, right? It's like, for example, a child, right? A child that's learning how to speak a language, naturally, they cannot express, what they feel completely, or, in a way that's very well understood. That is the reason why I have such an admiration for pediatricians in reality.
Yeah, that's good. And you brought up an interesting point. It supersedes just speaking the language. Certain words has a different context, a different meaning, and then that ties into the cultural aspect. It's interesting when I went off to Zambia, Africa to do some public health research out there last summer, we had rounds where we did home-based care. But I noticed I was going to their home and then we jumped right into just the actual clinical practice. However, in Africa, the culture, you're supposed to come in the home, sit down, chit chat for a little bit, and then start talking about the medicine and their health. That was that cultural aspect where I think here in America, you come in, we're typically on the clock, somebody else has something to do, so you just get straight to work, right? So it was kind of that cultural difference there, and that made them feel more comfortable as you came in to service them and their healthcare needs. So you're right, the culture, outside of the language helps you connect to the cultural aspects, which then brings in that comfortability. So I'm happy that you brought that up. And then I think that's a great segue into empathy. I think that's big across the board when it comes to a patient-centered focus when we're practicing medicine. Dr. Collazo, I speak with a lot of professionals, especially those in academia, that's teaching these up-and-coming physicians, and they're noticing a trend, and you can speak on this as well, that the younger generation of practitioners are coming through. They have the science, but they're seeing a disconnect with the empathy. How do you feel that we can enhance a more empathetic medical practitioners that's coming through the pipeline of medical school or PA school? And how can an individual that has that multilingual skill enhance the empathy?
That's a very good point. And in reality, Andrea, are some programs out there that have, second language as I had, for example, in my medical studies. I know that there's PA programs here in Miami where they teach Spanish, medical Spanish, obviously, but that helps them, increase their value as future providers. I would say that we need to evolve, right? So generations have their characteristics, and we cannot expect. Because we were not like our parents or grandparents, so we can expect that the new generations have important differences in regarding the social skills, etc., etc. Now we have technology, cell phones, tablets, internet, many things that it's very easy. I'm driving my car and then I have people in my car that are just watching TV on their cell phone, so we don't speak with each other while we are on a road trip, right? So that is a reality, and we all know how good or how bad how bad that can be for human relationships and empathy, but that is the reality. So how is that we're going to be dealing with that, right? In the classroom, I personally try to do is to acknowledge as much as possible all the diversity. Let's not talk about differences, but diversity that we can have in the classroom. And I love, now I work at a physician assistant program, and I love when, students ask about, well, how can I see that lesion in a person with a dark skin? So that is important. Why? Because you're getting into the that empathetic part of the of medicine in general. When I say medicine, I refer to every single discipline, specialty that falls under that umbrella. So it's not only the language, right? So we would benefit if we can have students doing Spanish or French or, I don't know, Creole or whichever language that's important in their community as an elective. That would be great. Acknowledging the diversity, and that's very important in medicine because, as I said, a skin lesion is not looking the same. So now we have measles, right? Outbreaks in the U.S. And the rash is not going to have the same characteristics. Typically, and even in my country, the rash was described based on patient with a light skin, right? But it is not only that way, right? So we have people with darker and even darker skin, or
Yeah.
people with, certain dermatologic conditions that could also alter the way certain skin lesions look like. So diversity is something that we need to acknowledge and we need to teach our students, right? And that leads to tolerance, recognizing what important having a diverse population might be. And that obviously opens the avenues for developing other skills.
That's good. That's really good. The diversity aspect, and I like what you said. Every generation is different. This younger generation, they have the technology, and sometimes the technology can produce the barriers there. So the social skills may not be as strong as prior generations, but we need to build the skills and the support to just foster that and educate them on those things. And especially with the diversity of patient care, that same rash that may be in your textbook and you're looking for that, but it may manifest on the darker skin different. So you have to make that delineation. What type of rash is this, even though this person has a little bit more melanin in their skin? And then how can I treat that moving forward? And that's part of the connection, right? And the tolerance of the diversity in patient care. So we talk about the advantages of having that multilinguistic skill like you have as a practitioner and an educator, but do you see any barriers that this could create when it comes to treating patients?
Yeah, obviously. I mean, in my case, Spanish is my natal, language, and I speak English. I want to say that I keep my French at certain level, and it is obviously an advantage when you can communicate with your patient or with your students, in my case, in their native language or in a standard language, because we've had students that are not US born students. They come from, I've had students from Uzbekistan. I've had students from Iraq. I've had students from all over Latin America. So, but here we teach in English, right? So in the case of the patient, it's good to have that direct communication without probably an interpreter, because of privacy. Let's say a woman from a certain country you were talking about the culture in Zambia, right? So probably a woman would not be that confident telling a male physician about some gynecological issue, right? But on the other hand, imagine that there was an interpreter right between them. So that would be kind of a challenge when they are trying to solve a problem that's considered taboo, or that's very private, and there are people that are not open to discuss this with another person that so that I would say it's a challenge. On the other hand, there are certain terminologies that are difficult to explain, because let me be clear, the fact that I can speak these languages doesn't mean that I am an interpreter. That is a profession, that is a specialty. So there might be certain circumstances that you will require an interpreter, right? So that helps you convey the information in the correct way. Also, for example, especially when you are not a native speaker, for example, for me in English, if I go to California or Texas, the phonetics, there are maybe certain slangs that I'm not going to be able to understand. So that is another barrier, right? That's definitely something that will require, in that case, an interpreter, so that I can give them or receive the right information. So there are certain limitations in the case of the medical terminology, the idioms, the phrases. That's obviously something that needs to be taken into consideration.
That's good. Interpretation, that's skill set all within itself, correct? And that's a median between, that two. I like to say a communication liaison. Now, when we think of interpretation and those professionals that's in that field, we want to go fast forward, and it makes me think of the modern technology now. So now I'm thinking about AI and how AI can help facilitate that more multilinguistic understanding between the patient and the physician. So, my question to you, Dr. Collazo, is how do you see that having that multilingual software from AI will enhance the human connection and enhance the patient comfortability and interaction with the physician?
That definitely is something that has come to change the life of people. I am a strong advocate for the use of AI, not only in medicine, in many different scenarios. In your life, you can, come on, you have ChatGPT on your phone, you take a picture of something and you get an explanation. Obviously, as I normally say to my students, you have YouTube, right? You can see an animation on histology, mitosis, meiosis. But please make sure you have your book or your slides or your notes next to you, because there might be certain mistakes, there might be certain errors. So the same thing happens with AI. I use AI a lot to prepare my classes. I use a lot of AI to maintain the structure of the lecture, so that helps me a lot in the sense that I save, not only am I saving time, but also I have a better structure of my lecture. So that helps me, time wise, be more efficient and more organized. However, there's something that is very important. And I'm going to go back to when we were talking about the interpretation, right?
Okay.
So in the case of AI, there are disadvantages, or there are challenges more than disadvantages. The challenges are the most important one is going to be that there's no extra verbal language, right? So we go back to cultural competence, right? When there is a student who does not speak my language, so we both speak different languages, and imagine that I am trying to just use a translator to communicate with that student. Let's say we don't speak, or that student is not proficient in English. If I had to use a translator or any of those AI devices to explain the histology of the heart, it would be difficult, because there is not that. Think about this: when you're teaching a class, or when I am teaching a class, I remember I was teaching the other day the acid-base balance, right? And I had to write on the board, because without writing on the board, it's extremely difficult to teach the students when an acidosis is respiratory or metabolic, because this is going up, this is going down. So when they saw it written on the board, they say, now I can get it. So that visual information that you can benefit from in a lecture or in a classroom settings is basically the same thing as, understanding the culture, the verbal, language, the body language, the contact that you can establish with the patient or with the student. So yes, I mean, AI, I would use it definitely to translate, but there is still need that eye contact. Like, for example, telemedicine, right? Many people do benefit from telemedicine. That has helped a lot in improving, healthcare access, but you still need that contact, right? That in certain situations, you need it there. You need that human to human, one-to-one contact.
So what I'm hearing is that it definitely needs to be a hybrid approach in the AI integration of how we teach our students as well as how we practice medicine. Because I like what you said, you embrace AI, right? And you use it as a tool to your advantage to consolidate time, to be more efficient, to structure certain things, but you still need to make that human connection there. When some things just don't click with your students, then you need to step in and fill in those gaps. Eye contact is very powerful. It allows people to feel seen, valued, and heard, and then they connect with you different. And sometimes the AI may not have that.
It's about we're social beings, right? So we need to engage with other people.
Yeah. That's what it is. Yeah, we need the engagement, right? That's what we
Yeah.
thrive on. And I wonder, what advice would you give a aspiring physician or healthcare practitioner or public health practitioner coming to America. They're not very well versed in the English language, but they have a need to serve in healthcare or public health capacity. What words of inspiration could you give them? What tactics and strategies so they can uplift themselves and be more confident in the skills that they can bring to the healthcare and public health profession?
Well, I mean, that's a very important point here, because in my case, I had the English language, but let me tell you something. When I came here, I said, my ears are squared. That's a kind of a translation to English of a Spanish, phrase when you don't understand, right? So it was difficult for me to understand, especially certain accents, right? Because I started with a method that kind of combined the American English with the British English. But when I came here, I said, well, let me pay close attention. I remember calling the bank and saying, okay, let me see if I understood what you say. So you meant this is I can imagine the lady over the phone was like, oh my gosh. But in reality, you have to practice. So the point is, you have to practice. If you have no English at all, obviously you need to start studying English, right? I don't know if it works for anybody better in an app like Duolingo or something like that, or if you have the time and the money to invest in a private English course, or go to a language school and study English. But then you have to practice. You need to practice. So practicality is very, very important, right? So as much as possible, speak with anyone else that speaks English better than you, so that you can practice and you can learn new, let's say, so understand, not just learn, but understand. Everything is about understanding. And then you're going to start trying to think in English. I remember my first times teaching here in the U.S. at a college. I had to, with those complex tenses, I had to think about it and slow down my pace. And because it's, we don't use the same auxiliary verbs in Spanish that you guys use in English, right? So I had to stop, slow down, and think about it. And sometimes I even made mistakes that I realized I had made a mistake, and I said, okay, sorry, and I corrected myself. But don't think that's impossible. Just start by studying and the way you prefer, and then practice. Practice. And when you come here, or any other country where you speak, where they speak English or any other language, you're going to probably, I'm not saying that you're going to, but you're probably going to feel like, what did I study for? I don't understand, right? And then that's going to go on the other side. You're going to be intimidated to say, to speak. So don't be afraid of speaking. Don't be afraid of making mistakes. And the best way to decrease or to mitigate that is to try to practice with other people, and then immerse yourself, right? So understand the culture of the place you're going to, so that there might be friendly people that you can speak, or there might be other countries that speak a language they're proud of, and they don't want people to make mistakes, or they don't want people to mispronounce their words, etc. So you need to understand that too, so that you can feel confident, or you can feel, I'm learning, I'm just practicing, and that's it. I think people value that.
I think you're right, because I was trying to study French, and as someone who was very proficient, they said, look, you have an accent. So whenever we hear that somebody has an accent, we're not expecting you to get all the words perfect. So they had taught me to get out of my head of trying to be so hard on myself to sound so perfect. You're not a native to that, like you said, that mother tongue, then give yourself a little grace, because a lot of times the people that you're going to communicate with, they're going to hear your natural accent, and they're going to give you some grace in the conversation as well. Sometimes I think we get in our head, and that can erode our confidence when moving forward.
Yeah, definitely speaking a foreign language is adapting your phonatory organs to these sounds that do not exist in your native language,
Yeah.
right? There are certain words in English that for me are still, even after living here for 18 years, are kind of difficult to pronounce, right? And in Spanish, we don't make a difference, at least in Latin America, we don't make the difference between B and V, but in French, you have to. So these are things that we have to overcome. Basically, I am imitating the American English, pronunciation. That is a reality. I am imitating it, right? So that's basically it, right?
Yeah, you're doing a fantastic job. And thank you so much for this insightful conversation of, just how someone with your skill set of speaking multiple language can further enhance patient care. We're wanting to have this conversation just to give insight to those professionals and how that can really tap into the empathy and the human connection, but also the cultural aspect that you can emerge with your patient so you can give them the best patient care possible. So thank you so much, Dr. Collazo. This was a fantastic and very informative conversation. I love your journey. I think it's so inspiring. And thank you for being on our podcast, Skills Without Borders, today.
I thank you again for having me, for giving me the opportunity to humbly share my personal experience, right? This is not academia, but this is something that I think it's extremely valuable. We as professionals need to share not only our knowledge, the one that we acquired through our careers, but also our own experiences, right? So that's very important. I applaud you for having this format, this type of podcast, which is very aside from academia, but it's teaching people out there important aspects of the health sciences and the life in general. Yeah. Thank you very much.
Thank you so much. I hope this Skills Without Borders that's powered by Upskill always encourage you to keep soaring higher. Thank you again.